Hello and welcome to this masterclass on cutaneous manifestations of systemic diseases, the first of which we will be focusing on cardiovascular system. It's important to identify cutaneous findings of systemic diseases because sometimes dermatologists may be the first to diagnose these underlying cardiovascular diseases. In this masterclass, we will explore the different dermatologic signs that may be suggestive of cardiovascular disease. So, we're going to start with infective endocarditis. It's an infection that commonly affects the valves of the heart, either native or prosthetic valves. It's a rapidly progressive condition and it spreads hematogenously, so it's really important to be able to pick it up quite quickly and start treatment, as it could lead to death in a matter of weeks. So the skin manifestations of infective endocarditis are thought to be as a result of septic emboli and immune-mediated reactions. The first of these skin manifestations are splinter hemorrhages. So this is what a splinter hemorrhage looks like. It's basically a leakage of blood into the epidermis of the nail bed, and these are really common and important signs to look for on the hands during a cardiovascular exam in order to rule out infective endocarditis. Second of which is the Osler nodes. These are painful red nodules that involve the pulp of the terminal phalanx of the fingertips and sometimes the toes. And then the last one is the Janeway lesions, and these are non-tender erythematous macules on your palms and soles. The second cutaneous manifestation of cardiovascular disease I'd like to go through today is the erythema marginatum. So this is a non-pruritic blanching erythematous raised lesion that normally involves the trunk and proximal extremities, but normally spares the face. So you'd normally see this in rheumatic fever, and rheumatic fever is a post-infectious sequelae of a group A beta hemolytic strep, sometimes known as strep throat, and this is thought to be autoimmune. So it's thought that the antibodies against the strep infection lurk around post the infection and then damage human tissue. And this condition is quite common in developing countries, not so much in developed countries, but it is useful to be able to pick out these cutaneous manifestations. For example, if you see erythematous raised lesion in the trunks or proximal extremities when carrying out a cardiovascular examination, but the rash spares the face, then you'd want to really try to investigate and rule out rheumatic fever. The final cutaneous manifestation of cardiovascular disease I'd like to look into in this masterclass will be those involving lipid disorders. So lipid disorders are where lipid metabolism has been affected, and they're usually due to genetic defects or sometimes secondary causes such as obesity. So lipid disorders are really important to be able to pick out and manage quite quickly, for example with statins, and controlling cardiovascular risks factors as well, because they can cause life-threatening cardiovascular diseases such as acute coronary syndromes. So the first cutaneous manifestation of lipid disorders I'd like to go through are xanthomas. So there are different types of xanthomas, and the most common that we normally see on clinical examination is the planar xanthoma, also known as xanthelasma. So xanthomas are lipid-laden infiltrates in the dermis or tendons usually, but the planar ones are kind of localized yellowy macules or papules, commonly around the eyes. And this is what a planar xanthoma looks like. The next one is tuberous xanthoma, and these ones are firm, they're painless, normally red or yellow nodule over your pressure areas, for example, your elbows, your knees, or the heels. And these ones are related to a type 3 hyperlipoproteinemia. Third one is tendinous xanthoma, and this one's linked to familial hypercholesterolemia. And so your tendinous xanthomas are smooth, firm, they're quite mobile, normally located on the Achilles tendon or a tendon over your knuckles, and there's usually no overlying skin changes with tendinous xanthomas. And the final one is the eruptive xanthoma. These are small yellow papules, and they've got a red rim over your extensor surfaces, and sometimes you can find them even inside the mouth, which is quite interesting. And they're quite tender and usually quite itchy. So with your xanthomas, there are different ways to manage them, but most of them will be treated once the underlying dyslipidemia has been treated. So once the underlying dyslipidemia has been managed, these xanthomas should decrease. You could also manage them cosmetically using topical trichloroacetic acid, cryotherapy, laser treatment, or excision. And this is an image just showing the transition prior to treatment with trichloroacetic acid to during treatment, and then a month later post-treatment. And this one is of a planar xanthoma, or just a xanthelasma. So I really hope that you have enjoyed this masterclass, and I will see you in the next ones. Thank you.